Okay, welcome to this explainer. Today, we're going to dive right in and unravel a pretty wild medical mystery that is literally hiding in plain sight inside millions of people. For a long time, medicine had this very specific and honestly kind of narrow view of what causes liver damage. But today, we're looking at a condition that's quietly reshaping global health, acting almost like a mirror to our overall metabolic well-being.
I want you to just think about that for a second. Imagine a really fast-growing, highly destructive condition that's damaging your body's engine, all while you feel absolutely fine. It's a silent threat, and we urgently need to talk about it because it absolutely thrives on our modern lifestyle. It's not driven by the usual suspects we normally associate with liver damage, but by something much more integrated into our everyday biology.
So, to break this all down, we've got a simple 5-part roadmap for this explainer. First, the silent liver epidemic. Second, unpacking the recent name change. Third, how liver damage actually progresses. Fourth, figuring out if you're at risk. And finally, protecting your metabolic health.
All right, kicking things off with Section 1, the silent liver epidemic, a hidden health crisis. Let's look at why this is such a massive global concern.
Here is the crazy part about this condition. It is completely asymptomatic in its early stages, meaning most people have absolutely no clue they even have it. They're just going about their daily lives feeling 100% normal right up until they go in for a completely routine, totally standard checkup. Maybe a regular blood test or a quick scan for something completely unrelated suddenly flags these weird abnormal liver findings. The stealthy, under-the-radar progression is exactly why doctors are raising the alarm. It really highlights just how critical regular health screenings are, especially if you're carrying other metabolic risks.
Moving right along to Section 2, unpacking the name change, from NAFLD to MASLD. Words actually really matter in medicine, and this recent shift is a big deal.
So for years, the medical community called it NAFLD, or non-alcoholic fatty liver disease. It was defined entirely by a negative. It was basically saying, hey, it's liver disease, but, well, it's not from excessive alcohol. But the new term, MASLD, which stands for Metabolic Dysfunction-Associated Steatotic Liver Disease, defines it by what it actually is. It's a real game changer, because it moves away from just ruling out alcohol and explicitly links the disease directly to your metabolic engine. It finally connects the dots between liver health, insulin resistance, carrying extra weight, and type 2 diabetes.
To be incredibly clear here, what we are talking about is a disease where your metabolic issues literally force your liver to hoard fat. When your body shows evidence of metabolic dysfunction, like abnormal cholesterol or high blood pressure, your liver cells just start packing away this excess fat. So it's no longer just some isolated liver problem. It's basically a full-body check engine light. And, this isn't happening in a vacuum. MASLD has skyrocketed to become a leading cause of chronic liver disease globally, all thanks to a perfect storm of modern habits. We're talking about rising obesity rates, highly sedentary lifestyles where we sit all day, diets packed with high-calorie processed stuff, surging type 2 diabetes, terrible sleep habits, and chronic inflammation. Because these things are just so incredibly common nowadays, the disease is spreading across populations like wildfire. Okay, on to Section 3, how liver damage progresses. Let's use an engine analogy to take the mystery out of the science. I want you to think of your liver as the ultimate central engine of your body. Its main job is to regulate your energy. But when insulin resistance hits, your body becomes horribly inefficient at using glucose for fuel. The engine essentially just floods, and because all that energy can't be used properly, all those extra calories get converted into fat, and the body just dumps a lot of that fat right inside your liver cells. The whole system just gets bogged down by its own fuel.
Now, this damage happens on a progressive spectrum. It definitely doesn't happen overnight. It kicks off with simple fat accumulation, which is called steatosis. But if you don't treat it, that fat triggers persistent, ongoing inflammation. That leads to actual liver cell injury. Then your body tries to heal itself by forming scar tissue, known as fibrosis. And finally, in the really advanced cases, it progresses to cirrhosis, which is permanent, severe scarring. The good news here? Not everyone with a fatty liver goes all the way down this path. Catching it before the heavy scarring begins is absolutely crucial.
While it is usually completely silent, a few people might notice some incredibly subtle symptoms. We're talking about things like persistent fatigue, maybe a vague, mild discomfort in the upper right side of your belly where the liver hangs out, or just generally lower energy levels. But because these signs are so common, who doesn't feel tired after a busy week, right? It makes it super easy to dismiss. That's why active vigilance is so important.
Which brings us to Section 4. Are you at risk? Let's identify those red flags.
Since the early warning signs are practically invisible, we have to look really closely at the biological clues. Even if you feel totally fine, if you check certain boxes, your chances of developing MASLD are definitely elevated. Things like carrying extra weight, type 2 diabetes, high blood pressure, high triglycerides, low, good HDL cholesterol, a family history of metabolic issues, or just not moving around enough during the day. These are the exact red flags doctors look for when they're deciding who to screen.
Actually, I want to pause and highlight a really surprising point straight from our source material. You can have a perfectly normal body weight and still develop this condition if you've got significant insulin resistance or other metabolic stuff going wrong under the hood. So, thin on the outside absolutely does not automatically mean metabolically healthy on the inside. You can't just judge a book by its cover.
All right, let's pivot to the optimistic stuff. Section 5, protecting your metabolic health, prevention and care.
Managing this whole thing requires a real two-pronged approach. On the medical side, your doctor has the tools, blood tests, ultrasounds, advanced imaging, and they can help you medically control your blood sugar and blood pressure. But over on the lifestyle side, that's where you hold the real power. We're talking about choosing nutrient-rich, minimally processed foods, getting up and exercising regularly, cutting way back on sugary drinks. Medicine can target the symptoms and monitor the damage, for sure, but these everyday lifestyle choices, they are what actually rebuild and support your liver health from the ground up.
The whole medical world is finally shifting away from treating liver disease in total isolation and instead aggressively addressing the broader metabolic root causes. Because understanding your risk today can genuinely prevent some incredibly serious complications down the road. So as we wrap up this explainer, I want to leave you with one final thought to mull over. What is one small, sustainable change that you are going to make for your metabolic health today?